something under your head? Okay. Okay. Are we recording?
Mm-hmm.
Hi, team. What's our muscle test? Adduction. So go ahead and push against my hand. There's her femoral triangle. And I can palpate, feel all her adductors fall off, and there's her hamstrings. And relax. Awesome. My endangerment sites, femoral triangle containing what?
Femoral artery, nerve, vein.
Lymph nodes.
Things.
Lymph nodes, other things. Yeah, femoral artery, vein, and nerve. Great saphenous vein is there. Lymph nodes. All kinds of fun stuff. We can do some general skin rolling as we're talking. Holler if you want me to lighten up. It can be a very spicy area. Second endangerment zone. Site.
The whole.
The hole.
Hiatus.
The hiatus. Hiatus means hole. Or gap, I should say. The adductor hole. Adductor hiatus. And all along that adductor canal that contains all the same stuff Aaron just said. The canal is just a tunnel and it all vacates here at the hiatus. Takes a sharp turn, goes down the back of the knee. So we're just starting with some gentle skin rolling. You see it's mainly focused. I'm going this way and I'm using my thumb. I'm applying pressure here, keeping it easy. Go slow and be very, very mindful. The area we're treating is all right through here. Anything from here over is all quad. Remember, medialis kind of merges with some of our adductors on the back because they all share that same attachment site on the medial lip of the linea aspera. You can do a little torquing if you want to. I would not advise chucking. Maybe just at the knee. And pinch and hold. Pinching is actually part of the treatment of this. So let's try and identify some of these structures. Push. Relax. What's this medial attachment site for, or structure for this adductor femoral triangle?
Magnus. Adductor magnus.
Longus.
Longus.
Adductor longus. Remember, it's longus, sartorius, and inguinal ligament. So once we've identified longus, it along with pectineus are the more superficial, then brevis, and then magnus, and that's going to be our order of treatment. Sartorius runs across and gracilis runs along, so we're also going to hit the sartorius is the other side of this triangle. So we're going to pinch. Doing okay? If I can get a good enough grip, I might bring in an adduction. I got you. And I'm just pinching on her sartorius. Fingers are in the middle of that triangle here, but I'm not applying pressure. I can't grab onto it by just pinching, so I'm doing oppositional to my fingers to treat sartorius. I can identify its borders, but in this particular instance, I can't pinch it. Some people you may be able to. You may be able to just like grab onto it. Same thing with their gracilis, because they're so superficial. And you would just continue this pinching as best you can, following the muscle. Doing all right? If you remember last week, we didn't really treat sartorius, did we? Kind of just focused on quads. This is why. Follow it, pinch all the way down. Can identify gracilis as well. That one's easy. I got your gracilis. Please hold your pinches a lot longer. This is just short enough for the demo.
For like 10 to 12 seconds, or like 20.
You can even go longer, up to a minute. Whenever you pinch on a muscle and compress and squeeze, you can hold up to a minute. So your grip strength will improve, your endurance for holding. Kind of loose, gracilis. Up. Might be as high as up as I can get it. Longest is next. Can't really pinch that one. We're going to switch to effleurage now. So this is the part where you have to ask your client, can you take your hand outside the sheet? Please cover up your personal property. Chinch. You could even have them, hey, I'm going to give you a little bit of that sheet. Can you just hold it out of my way for me?
Mm-hmm.
Just slide it to the side and hold. Oh, take it back.
Oh, sorry.
Yeah, hold the sheet. Thanks, bud. So we're going to get up close, but definitely never, not ever personal. You can effleurage with your hand. Nice, broad, flat palm. You can do forearm. That's a little bit more comfortable. The broader is better for adductors. They are very, very spicy. Are you comfortable, Brandy?
Mm-hmm.
Treat what you find. How are we doing through there?
Mm-hmm. A little spicy, but it's okay.
I'm doing compression with the palm of my hand. I'm using my other hand to stabilize. I could do fingers, but that's not super comfy, is it? My palm a little bit better.
Mm-hmm.
Not really in a position to do fists. You do forearm compression. All right. I don't really want to do elbow. I'll leap off the table. You can do some active release. Compress in. Take a nice deep breath and try and bring your leg in ever so slowly in that action when I had you do muscle testing. Push against my hand. Exhale and relax. So I was compressing on a top band. You can see my fingers. And I had her bring her leg inward in adduction, push against me. And on her exhale, she relaxed. So a little active release. I'm compressing in on top bands, activating the muscle, exhale, relax, and then I kind of effleurage over top of it. Are we doing all right? In between all your treatments, whether you choose to do fingers, fists, palm, do a little active release, lots and lots of effleurage to calm this area down. All through it. Once you've softened up longus, sartorius, taking your treatment all the way up, we got to get our friend pectineus and brevis. Remember, they're located inside the triangle. Pectineus on top of brevis. So we're going to identify it by finding that pulse. And I'm going to move a little bit medial. I got you. We're going to do some passive movements